young adults in particular, this is so important. Young adults are the age group that is most likely in our country to be uninsured. And it's for obvious reasons. They're in entry-level jobs that don't pay much and don't provide fringe benefits that are like other positions, or many still don't have jobs. And so what the Affordable Care Act does is a number of things. First, for those people under 26 years of age.
Go back into parents' health care insurance. I know that one really well.
All right, cool. All right, very cool. Now, for those who can't get coverage saved through their parents, they are now going to be able to go into these new marketplaces, choose a plan, and they are likely to be eligible for a subsidy, a tax credit subsidy, that's going to significantly reduce their costs for premiums. That's a big deal. And so my hope is that as many young adults know about it so that they get enrolled and they get the benefit of these subsidies.
Wow, I think you're completely right, and I think it's what we have to do now. And I think what I've just being at this conference and talking to some of the great participants you guys have here is we now have to take this conversation to young people, and really figure out a way by using platforms like ours and other radio platforms and television platforms, finding a way to communicate that to that millennial demographic, that 18 to 35. And say that, listen, here are the steps to being part of the marketplace or being part of the exchange. Here's the steps to get back on your parents' health care insurance. I think that's a conversation that's now missing now that we have the law in place. And it seems as though you guys are definitely going in the right direction with all the folks here who are going back, leaving this conference, like the president say, fired up and ready to go to get on the ground and really implement this stuff.
You bet. And, a lot of people in the millennial age bracket, I'm a little bit out of that right now.
Just a
tad. But people who are in that millennial age bracket, they often think, I'm invincible. Nothing's going to happen to me. But many play sports. You play football or basketball or soccer. Something can happen to you, and people really, if they can get coverage that's affordable and they get the help, I think people are going to really appreciate that. So when you're when you go up for a layup and somebody hits you real hard and you break your arm, you're going to want that care pretty quickly.
I think you've done a good job of crystallizing why millennials need to get it. Now I think the question is how we get that message to them, and hopefully Families USA will continue to be a partner in pushing those things forward and moving that agenda forward so that millennials are getting the coverage that they need, sir.
Well, we want to work with you, and it's really important that this age group actually learns about this, because they are going to get the most significant tax credit subsidies. These subsidies are provided, it's called on a sliding scale. So the lower your income, the higher the subsidy. And if somebody's in an entry-level job and they're getting paid relatively low, even though they're working hard, they're going to get a significant subsidy. And so we want to make sure this really works for people who are otherwise going to find health insurance unaffordable.